They lifted up the eye, went into the corner and tapped it through, and wiggled it around with this egg beater thing. To me, it's insane. And when you're talking about the brain, shouldn't there be some precision involved? This account is an excerpt from the book My Lobotomy by Howard Daly, a 12-year-old who had just had his brain picked and prodded with an ice pick in one of the most horrifying procedures in human history. Welcome back to Dana Reviews, where today we take a look at the story of Walter Jackson Freeman. Remember to subscribe. Walter Freeman was a physician who made a reputation for himself as the world's first and only traveling lobotomist. He did not invent the procedure that made him famous or infamous, but he made it a lot more mainstream than it had any right to be. After performing more than 4,000 lobotomies, at his peak, Freeman conducted up to 25 lobotomies a day. Freeman was born on November 14, 1895, and raised in Philadelphia, Pennsylvania. He came from medical royalty. His grandfather was a surgeon in the Civil War, while his father was a successful physician in his own right. Freeman attended Yale University beginning in 1912 and graduated in 1916. He then moved on to study neurology at the University of Pennsylvania Medical School. Freeman earned his PhD in neuropathology and secured a position at George Washington University in Washington, D.C. as their head of the neurology department. Now, around the same time, but 4,500 miles away in Portugal, fellow neurologist Agus Moniz was performing his very first leucotomy procedure, which basically meant taking chunks out of patients' brains in an attempt to treat their psychiatric illnesses. The work of Moniz inspired Freeman, and he adapted the procedure and renamed it the lobotomy, where instead of taking bits out of people's brains, he just cut the connection between the frontal lobe and the thalamus. One thing stood in his way, however. Freeman was not a surgeon. He fixed this issue by enlisting the help of a neurosurgeon, James Watts. On November 14, in 1936, they did the very first prefrontal lobotomy in the United States on a housewife named Alice Hood Hammett, who suffered from anxiety, insomnia, and depression. They performed the procedure in an operating room using sterile surgical technique. Now, this will become important as we go on in the story. Watt operated while Freeman directed from the sideline using his extensive knowledge of the anatomy of the brain. 6 days after the operation, Hammett experienced transient language difficulties, disorientation, and agitation, but she was sent home, and Freeman considered this outcome a success. By 1942, the pair had performed well over 200 lobotomy procedures and published results, claiming 63% of their patients had improved, 23% were reported to be unchanged, and 14% became worse after the surgery. According to Freeman, however, these were rookie numbers, and he wanted a way to perform these procedures quickly and crucially outside the operating room, where, brain surgery is usually performed. Freeman formulated a new procedure called the transorbital lobotomy. This allowed him to perform lobotomies without the use of anesthesia because he had used another controversial procedure at the time called electroconvulsive therapy to sedate his patients. This procedure involved using a mallet to tap in a bitter glass, which was basically an ice pick, through the roof of the eye socket. Following penetration through the orbital roof, Freeman will then access the brain and wiggle this tool laterally to destroy some of the frontal lobe tissue and sever the connection between the frontal lobe, which controls movement, and the thalamus, which controls the regulation of consciousness, sleep, and alertness. So this basically broke the connection between the part of the brain that controls emotions and the part of the brain that controls the ability to act those emotions out. The very first lobotomy conducted by Freeman and Watt took about an hour to complete and was done in an operating theater. This new technique took about 10 minutes and could be done pretty much anywhere. Watt was horrified by this new approach, and he wanted no part of it, so this led to the end of their partnership. With his newfound freedom, Freeman traveled across the country, visiting mental institutions, performing lobotomies, and spreading his views and methods to institutional staff. The sight of Freeman in his lobotomy bill, as his critics later called it, became very common in most psychiatric institutions around the country. Initially described as a surgery of last resort for psychiatric patients for whom all other treatments had failed, Freeman began to promote the lobotomy as a cure for everything, from serious mental illnesses such as postpartum depression to other very minor ailments such as insomnia, behavioral difficulties, and even indigestion. One of his most famous patients was a young man called Howard Daly, who was lobotomized at age 12 simply because his stepmother was afraid of him. Howard survived and has since written a memoir titled My Lobotomy, detailing his experiences at the hands of Freeman. During his trips, Freeman would do up to 20 lobotomies a day, most of them with very little medical justification and unfortunately sometimes bad outcomes. An account given by one of his assistants was that a patient consented to a lobotomy but then got cold feet and locked themselves in their hotel. The family called Freeman, who then went to the hotel to try and convince the patient. When he got there, the patient was a little agitated, so Freeman gave him a little shock with his portable electroconvulsive machine to calm him down. While the patient was lying on the floor experiencing the after effects of the convulsion, Freeman thought this would be a great opportunity to lobotomize him anyway, so he took out his ice pick and mallet and did just that. Freeman was also quite the performer. During his marathon surgery sessions, he would invite journalists to talk to them about his medical procedures, and during these times, he would occasionally showboat to them using his two-handed techniques, which basically meant hammering two ice picks into two eye sockets at the very same time. In 1951, as Freeman was performing a lobotomy on a patient at Iowa's Cherokee Mental Health Institute, he suddenly stopped to pose for a photo. During this time, the ice pick slipped and penetrated into a patient's brain, tearing a blood vessel and causing catastrophic bleeding. The patient died almost immediately. Due to Freeman wanting to complete several procedures in a very short period of time, and his wanton disregard for basic surgical principles such as sterile technique and pain control, a lot of his patients suffered catastrophic complications, including bleeding in the brain, epilepsy, permanent changes in personality and emotion, infections, dementia, and at least 15% of his patients died. Considering the number of procedures that he did, this translates to about 490 patients. Now, to put this into perspective, one of the world's most famous serial killers, Ted Bundy, killed 35 victims. Freeman conducted his very last lobotomy on a patient called Helen Mortensen in February of 1967. Mortensen was a long-term patient of Freeman and was receiving her third lobotomy from him. She'd bled to death, a fate that was shared by as many as 100 of his other patients. Freeman was finally banned from performing any sort of surgery. Freeman was ostracized by the medical community. He retired from his position at George Washington University and opened up a modest practice in California. Freeman died on May 31, 1972, aged 76, as a result of complications arising from cancer of the lungs. Freeman's desire to help the mentally afflicted, who often lived in mental institutions where neglect was rampant and a successful return to society unlikely, was by all appearances very genuine. His promotion of lobotomy as a psychiatric treatment at a time when antipsychotic drugs were not available for mental disorders also broke important ground for the field of neurosurgery. His work contributed to the field of psychosurgery, and his legacy remains ingrained in the collective consciousness of all those who seek to treat mental illnesses with neurosurgical interventions. However, the horror stories arising from the eyewitness accounts of his work and some of the tragic outcomes of the patients he's operated on and his wanton disregard for basic surgical techniques have made this a fringe specialty in the history of medicine and a fuel for a lot of horror movies and nightmares. Thank you very much for tuning in, and remember to like, share, and subscribe, and always keep on learning. See you next week.